Hello, everyone. I'm Vish, one of the junior doctors from the University Hospitals of Leicester NHS Trust, HPV Unit, Leicester General Hospital. And today, the topic of my seminar is outcomes of gallstone complications during the COVID pandemic. Let's just have a brief background of our study. So as the data and metadata from the SARS-CoV-2 pandemic matures, the true impact on non-cancer, non-emergency surgical practice is becoming apparent. This is especially true in healthcare systems that were among the earliest to be affected, but all surgical services were forced to rapidly adopt different working practices. This includes conservative and non-conservative approaches, inevitably resulting in significant increased waiting times for definitive surgery. One widely employed practice was the increased utilization of the radiological percutaneous procedures such as cholecystostomy for the complicated gallstone diseases, the intercollegiate general surgical guidance, and the COVID-19 recommended either non-surgical management or cholecystostomy trains in the management of the acute biliary diseases, replacing the gold standard practice of early laparoscopic cholecystectomy within 1 week of index admission, with drainage reserved for the high-risk patients where surgery is not appropriate. So as the consequences, the management of the gallstone diseases during the COVID-19 pandemic, a clinical investigator group have reported a 72.2% decrease in the cholecystostomy rates since the onset of the pandemic, as well as a recent study reported a 7.2% cholecystostomy placement in a cohort of 864 patients with cholecystitis during the pandemic, although they did not compare this observation with the historical data. Let's move towards the methods of the study. So this is a retrospective study presenting the impact of the gallstone diseases in our HPV unit during the 5 months of the COVID-19 pandemic from March 2020 to August 2020 compared with the equivalent period in 2019. So a patient presenting to the HPV unit with a coded diagnosis of gallstones were included, and during the study period, 1447 patients presented compared with 1413 in 2019. And in 2020, compared with the 2019, there was a significant decrease in patient presenting with the cholecystitis, 240 versus 313, but no significant differences in the patient presenting due to the gallstone perforation, just 44 in 2020 and in 2019, just a 15 patient. There was also a non-significant increase in the patient presenting with gallstone pancreatitis compared with 2019. So literally it's just 74 versus 61. And as anticipated, there was a 45% decrease in the number of emergency cholecystostomies performed during the pandemic compared with 2019. So we did around 201 this year, while 365 in 2019. Interestingly, the numbers of cholecystostomies were comparable, with 11 in 2020 and 15 in 2019, representing significantly a less than 7.2% figure published by the Bekhyat couple. So in conclusion, in our study, there was a decrease in patient with cholecystitis and perforation, and there was an increase in patient with the gallstone pancreatitis, increasing the waiting list with increase in the incident of the serious complications. In our trust, we currently have 656 patients awaiting cholecystectomy compared to 280 in August 2019, so which is a huge number. So I still remember during my on-call in the surgical assessment unit, one night we had admissions of 11 patients with cholecystitis, as well as the previous cases of the gallstone pancreatitis and other causes coming and needing the surgery. With the recent elevation of the alert level to 4 and increased government restriction in an attempt to avoid a second national lockdown, a consistent national approach is required to mitigate this risk. However, as this was the previous study done a couple of months back, so now we are already in our third lockdown, and again the surgeries the elective case has been stopped in our unit, which has further impacted it, and the number of pending cases are just increasing. And like we've suggested previously, prompt approach to mitigate this further risk should be done, as we can see a lot of patients coming with the possible complications as well as the repeated onset of the conditions as well. Thank you very much, everyone. Thank you for listening.